I want to welcome you to our final webinar of the year. I can't believe how quickly 2018 has gone. My name is Jeannie Alter. I'm the Executive Director of the American School Health Association, and we're thankful to have you here today and want to tell you a little bit about ASHA and who we are. The mission of the American School Health Association is to transform all schools into places where every student learns and thrives. And we envision healthy students who learn and achieve in safe and healthy environments, nurtured by caring adults and functioning within coordinated school and community support systems. So we're really excited to let you know that our conference is coming in October 2019 in Cincinnati. So we hope that you'll mark your calendar and save the date and join us there, where you can learn more about ASHA, learn more about what is important to us and how we can best support our students. Just a little bit about membership in our organization. We have several benefits. One is our wonderful journal. We have a peer-reviewed journal, the Journal of School Health, or JOSH. We also have a great deal of information and expertise that is available to members, whether that be through networking within the membership. Also, we have our annual conference and a newsletter that allows you to share information and learn from others. We also have continuing education. Members receive free continuing education credits for things like our conference, as well as webinars like today. We also have an ASHA Career Center where we have discount rates for job postings within that Career Center. And we've recently added a new member benefit, which is a 15% discount on any American Academy of Pediatrics publications. So we're happy to report that. I want to welcome today's presenter. I want to give her plenty of time to be able to tell you a little bit more about what she has been working on. Anisa Heming is the director of the Center for Green Schools at the U.S. Green Building Council. She provides strategic direction to USGBC's work in schools and coordinates an organization-wide team to promote environmental sustainability, health and wellness, and sustainability literacy in school systems around the world. So we want to welcome Anisa today, and thank you so much. I'll turn it over to you.
All right. Hi, can you hear me?
Sound great.
Okay, great. And I'm also starting my video in case anybody wants to say hi and see what I look like. So thank you so much for having me today. I direct our Center for Green Schools at the U.S. Green Building Council. So our USGBC's mission is for greener, safer communities for everyone. And we do that through mostly standard setting for the built environment. So a lot of you might know the LEED rating system for buildings. We create that with a series of volunteer committees, and we have about 12,000 member organizations around the country that contribute to that thinking and that standard setting. So that is a big part of what we do. The Center for Green Schools is within the U.S. Green Building Council, and we are focused on healthier schools, schools that reduce environmental impact, and also schools that teach students about sustainability and the environment. So those are the three major components of a green school that we focus on. So every year we do an analysis of state policy, state legislation for a network of state legislators who care a lot about the environment and about schools. So these are folks that have joined a list to understand what we can find out about green school policies. And so we've done a paper on green cleaning policies, on energy efficiency funding for schools. And this year we did a paper on lead testing in school drinking water. So I'm gonna share a presentation here. how's that looking?
Looks great, thank you.
Okay, great. All right, so this paper was released a couple weeks ago, so it's brand new, and it's focused on state laws that relate to lead testing in school drinking water. So we're not focused in this paper on policies that support lead testing or state regulations that support lead testing. Those we decided to focus on laws because they do have the potential to stick around for a little bit longer and are more likely, we think, to affect long-term change. So we looked for state laws that had anything to do with lead testing in schools, K through 12 schools. So what we know is very recently that GAO put out some survey data that some of you might have seen on the scope of the issue that we're dealing with lead in school drinking water. The most concerning number here to me is the 16% of schools that have no idea if their water has been tested or not. It's also concerning clearly that about 41% of our school districts and schools have not tested for lead within their school drinking water. So this is very concerning to us, and as I'll explain, there's nothing that these schools are doing that's illegal in not testing. This is not required of them. It's not required of anyone around them to test for lead in school drinking water. So, so the only way to fix that is to make it required of them, or make it required of someone around them to test the school drinking water. So I should say within that GAO study, the reason the GAO did that, the General Accountability Office, the reason they did that was to give guidance to the EPA and the Department of Ed about what kind of guidance they should be providing to schools. And so they did, the major part of that GAO release was a series of recommendations for EPA and for the Department of Ed on what they should be changing about the way that they approach this issue. So the reason that no one can just wave a magic wand and make this required or make this go away is that the structure around federal regulations related to school drinking water don't require anything related to testing schools. So community water systems are the entities that are responsible for the water that flows in the pipes in most of our communities. So there's some exceptions, well water, schools that are on well water, et cetera, like those are kind of held outside of what I'm going to talk about right now. But the community water systems are responsible for keeping healthy water within those systems, and they are required to test to make sure that the water within the system is complying with regulations that are federal regulations. So there is something in place for that. However, they're required to test at what they call Tier 1 sites, and those include some community services, the outlets that are at community services, but mostly Tier 1 sites are actually homes. So a lot of times community water systems are required to have a certain number of tests going on at homes throughout their service area. They're not required, Tier 1 sites do not include schools, so there's no requirement to test at schools. As you guys probably understand from your work in health in schools, lead can come from a lot of different places within the delivery of water at a school. So it can be fine when it leaves the main water line, but it can like absorb and get more lead from the things that are within that building. They don't actually have to be that old, because the the rules around all these different components that are in this diagram from EPA, the rules around those have been changing over the last 20 years or so. And so actually things that are built relatively recently could have some lead components that could be leaching into the water. So, so there's all kinds of places, which is why a lot of facilities directors that we work with around the country consider this sort of a game of whack-a-mole, because if they find lead in an outlet in a school, then they try to trace it back to the component that might be causing it, but it's very hard to find actually. And the community water system is only responsible for what's in that main water line, not what might leach in after it leaves the main water line and goes into the school. So what we're looking at is how we can help schools understand what is happening once that water starts coming into the school. So these are the laws that we identified. You can see the dark states on the map on the left are the state laws that we identified. And then there's a timeline for you on the right. So Safe Drinking Water Act is a major milestone, and it's been amended several times. And then really the public awareness of the fact that something needed to be done, especially for children, came around the time of the Flint water crisis. So that was 2014 or so. And that's when, it takes a while for legislators to draft legislation and understand what's needed. And so really this amazing group of state legislation really started in 2016. And we're learning a lot about these bills, but the laws are relatively new, so it's actually, we'll learn a lot more as we go forward, because we don't know enough about some of these that just passed to see if they're really effective. So I'll walk through some of what we know, and then we'll leave some questions open, and hopefully we can get them answered in the next few years. So I do want to point out, some of you might be in the states that are light shade, but you've heard that you have to test school drinking water or something like that. There are a couple of states that have very strong regulations that are not legislated, but they are have been put out by the Department of Health or something like that. And so those, the ones that come to mind are Massachusetts, and New Jersey. Those two especially have some pretty strong stuff in place that's not a law. So if you're in one of those states and you are wondering why they're not on the map, that's why. There's also, I should mention, I think probably just Louisiana, I need to mention at this point. Louisiana's law is very different from the other laws, and we're hoping that they will do a little bit more in the future. But the law that they passed was just a pilot program for their Department of Health to test 12 schools in the whole state, 12 schools, to see, what kind of scope of the problem they might find. And so the Department of Health was supposed to identify schools that were most likely to have a problem, and then test those schools, and it was just 12 schools. So the other laws that we're looking at are really like, setting up an expectation of testing all schools, at various times in the future. And Louisiana's law is quite different than that. They actually just put out their results in October, and they found no level of lead that was concerning in any of the 12 schools. However, they've had a couple of news stories come out in the last year or so about entire school systems where the water quality has had problems. So there's definitely work to be done in Louisiana. So as you can imagine, it's pretty difficult to understand effectiveness when it comes to these state laws. The best measure of effectiveness would be blood levels of lead in the children, like what's actually the result of these laws being in place. They are very new, so we don't, in some cases, the things that have been found in schools, they haven't been remediated yet. So it's a little hard to tell, you know, what the before and after effect is of the laws. So what we've done is identify these four factors in effectiveness, and those are across the top here. So what's the coverage of testing? How many schools are actually tested? The second is testing implementation, so how it's being implemented. Then the third is risk reduction. So this is things that we would expect to actually reduce the risk of exposure to children. And then fourth is disclosure. So this is anything that communicates results to the public and to people who can make changes within the school. So these are the four factors that we've looked at, and then along the left-hand side here are the features of the laws that we then looked at that had anything to do with that effectiveness as we're defining it. So I'm not going to go through each of these features. I have picked out three, however, to dive into with you guys. But in the paper, we have a section for each of these features that looks at how the laws relate to each other, how they're similar and different, and what kind of effect they seem to be having on the effectiveness of the laws. We also in the paper have summaries of each of the state laws, so short summaries written in plain English so you can understand what they look like. And then we also have at the end of the paper a table of laws that have each of the states and then sort of each of the major features of that law, so you can see all the features kind of next to each other and compared to each other. So first we're going to go into mandatory versus voluntary. So most of the laws that we looked at are mandatory in some way. So typically the laws require that all schools be tested. The differences come in how often. So some laws are a one-time deal. They just said we want to know the state of the field and understand the scope of the problem. And so, for instance, Illinois' law says, you know, this is what we just want to know right now. So they're testing every school, but there's no plan for retesting. Some of the laws say every drinking outlet. Some of the laws say a certain number of outlets per school. Some of the laws say every outlet, but they don't give enough money to do that. So Rhode Island's law, for instance, says we want every school and every outlet tested by the state agency, and here's your money to do that. And the state agency said we can only do 3 outlets per school with that money. So it kind of depends on what's allocated for actual testing. You can see on this slide that two of the laws that are voluntary that are sort of least successful in being voluntary are Washington and Colorado's laws. And I've written here what the numbers are for those so far. Basically, they said we'll give grant money to local school districts for testing of lead in school drinking water, but there's no money for remediation. And you know, if a school system tests, then they really need to act on what they've tested on. And so a lot of school districts and schools are not taking them up on the grant money. It's either because they've already tested, maybe, or because they kind of are scared to find out what the problem is. which of course we don't think is a reason not to test, but it does seem to be what's happening with these grant programs. I'll note that one other state that is voluntary that seems to be successful at being voluntary is Pennsylvania. Pennsylvania's law is voluntary. However, they're required to tell the public if they decide not to test and why they've decided not to test. And so they're required to tell the public in a public board meeting and mailings to parents why they're not testing for lead. And that seems to have worked so far. It really does sort of lean on the public's diligence, however, in enforcing with their own school board and their own school leadership. And so, over time, that may slip. That diligence by the public will likely slip. So the second factor or feature of these laws that I wanted to talk about is responsibility for testing. Most of the laws require that the local education agency or the school district test the school drinking water. There are a couple issues that we heard about when we were interviewing people about these laws. We heard that school systems are not set up to do this effectively. They often don't have staff who are trained even to manage the consultants who do this work. They are not familiar with testing protocols, that sort of thing. And, the one that you would guess, they also are not being given money to do the testing in most cases. So it's an additional burden on their resources. In some cases, Washington, Rhode Island, and DC, the state agency or the district agency in DC's case, are in charge of testing. And so in that case, the legislature generally has allocated some budget dollars or has directed that some of their budget be spent on testing schools. So in those cases, the burden is off of the school district. California is highlighted here because California is very interesting and it looks like a very successful model. California has put the burden of testing on its community water systems. So as I talked about earlier, community water systems are testing water anyway. They're testing at many sites around their systems. And so this just requires that they add schools to that mix and that they test the water at every school as they're doing their sort of system-wide testing. So it doesn't appear that it's adding a lot to the financial strain on these systems. From what we heard, some of the small community water systems might be having an issue, but most of the medium to large size water systems are, this has just sort of been incorporated into what they do. And then they're required to give the results to the state and to the local education agency. So the other thing we're seeing that's a benefit of this is that the community water system and the school district keep each other accountable. So the school district knows whether or not the testing's been done, and the community water system knows whether the school district has informed parents and has sort of held up their end of the game. So there's also, it introduces a mutual accountability, which is pretty strong. So that's a real benefit of this approach. Let's see, the community water systems also have the personnel and the training to do this testing, which also makes this a strong approach. All right, and the third feature that I wanted to touch on is the action level for lead testing. So this is a highly contentious issue if anyone of you have done work in this area. The The EPA in 2006, in their guidance to schools, recommended action to remediate when an individual outlet at a school, when the lead level was tested to be 20 parts per billion or higher. There's also another action level that has been referenced before by EPA, where community water systems, if the average of their tests across their system was 15 parts per billion or higher, that's their action level to do something within their system. So there's these two action levels that EPA in the past has referenced for action to remediate against lead. EPA's new guidance released in October, and I'll in a second I'll give you the link to that guidance. Their guidance to schools states very clearly that there is no safe level of lead for children or safe level of lead in school drinking water, and that any decision making by local or state agencies about an action level should be made sort of case by case basis, basically. And so that's really, they've basically taken away their guidance and pushed it down to the state and locals to sort of figure out what they think they want to act on. Unfortunately, most of the laws that were passed in 2016 and 2017, especially before this very new guidance came out in October, reference 15 or 20 parts per billion. And so, you know, I respect that those legislators were working with the guidance that they saw from the EPA. However, at this point, they are probably going to have to reconsider their legislation and see if they need to drop that level of for remediation. Washington, D.C. has set their level at 5 parts per billion for test results. Several of you also might know, if you know the issues around testing, that it's very hard to get an accurate result anywhere below about 5 parts per billion. The level of lead in drinking water can fluctuate drastically depending on when you take the sample and what the average is over time or across the course of the day. And, you know, sometimes a filter is blocked and all of a sudden gets unblocked and you get a big amount of lead in the drinking water. And so it's sometimes really hard to get a consistent reading. And so this 5 parts per billion seems to be a pretty good model. DC is testing this out to see if they, you know, are able to act on anything that they see at 5 parts per billion. And we will learn from them if that's something that we can put into statute, because that's really the issue here. Is like, what can we put into law realistically? So there is some new guidance that was just put out by EPA. This is the new 3 T's for reducing lead in drinking water: training, testing, and taking action. And so this link here is where you can find that. And I know you guys will be receiving this presentation after we're done here. So this is the toolkit that explains to schools in particular how to deal with water quality testing, water quality issues, how to do testing, you know, what the best protocols for testing are. So this is brand new, just 2 months ago or so. The other thing I wanted to note is the drinking water grants that were just passed by Congress in, well, I think this act was passed in the spring, and they've just been formulating what the grant programs are going to look like out of the act that was passed by Congress. So there are 3 grant programs that EPA is planning to release that have to do with helping schools and and other entities in testing and treating lead in drinking water or drinking water quality issues. And the first group of these grants is being released very soon, and they will be for testing. The next group of grants is for remediation. So this testing, the thing that you need to know for the testing grants is that states are required to submit their letter that says we're interested and we're ready to receive these grants, and this is, you know, our plan for how we're going to administer the grants. They're required to submit that letter by January 11th. So if you care a lot about this issue and you want to make sure that your state is ready, the state Department of Health, or whatever the equivalent is for your state, would be working on this letter, and they need to submit it to the federal government in mid-January. So that's something for you to check in on in your state. There is a lot more information about this grant in particular at the link here on the bottom of the page. All right, so that is it on my end, and I'm happy to answer whatever questions you guys might have for me. So feel free to open that up. Jeannie, I think you're muted. I just saw your video pop up.
You're right, I was. I mute myself in 2 places, so. Thank you so much. I wanted to ask you a follow-up question, as well as invite anyone to type in the chat box, and I'd be happy to read those questions or comments. That would be terrific. One question that I had about the EPA funding is, my understanding was, and I want to make sure that I have this correct, my understanding was that the EPA sent letters to each state's governor to let him or her know that this funding was available and that they needed to respond. So is the governor's office a good starting point to kind of find out whether or not states are taking advantage of this?
Yeah, the governor is sort of the buck stops here point, but it would definitely be something that would have been delegated down to the agencies that would be, you know, responsible for administering the grants. So you could certainly start with the governor's office. They would know at least where it was assigned. But if you already have relationships with your state's Department of Health, that's another like easy place to ask. Right. And honestly, if the governor hasn't talked to the Department of Health yet about this, if the governor's office hasn't gotten down there yet, then that's also a problem. So
because that deadline is in January, correct?
Yeah, January 11th. Yeah.
Mm-hmm. To your knowledge, is there funding for every state? Should every state want that funding?
Yes, there is funding for every state, to my knowledge, and it's significant enough to really help with testing. So if a state legislature, for instance, is having trouble, you know, figuring out how they could make school districts pay for testing, this would be one way to get over that burden for the school districts and make it more realistic to the state leadership to now require testing in their states.
Terrific. And if an individual or a group, let's say within the school building, we're wanting to kind of rally around this issue and get support behind maybe applying for these funds, who do you see as kind of the most likely suspects to involve in kind of a coordinated effort? You know, would you involve the school nurse? Would you involve counselors? Who do you see as being really great allies in terms of coordinating an effort around reaching or around this issue in general?
I mean, my instinct is to say everyone, right? But
Right.
but school nurses certainly are critical. They're seen as trusted keepers of student health in particular, and so if they show concern about the issue, that is a powerful voice for doing something. I would also say facilities and maintenance staff are pretty critical to get involved, because they are going to be the ones to coordinate remediation if something shows up. They also might know if testing has been done. So if a school site doesn't understand if their school has been tested, they should know if it's happened. But if they don't, then the people to check with would be the school facilities department to understand what's been done already for school water quality testing. If the school is relatively new, they also would have information about the components and the fixtures and the fittings and pipes and all that stuff that has been put into that school. So there's also the ability to talk to them about the level of risk that might be there in the school.
Terrific. So Paul asked, do we have any sense of a timeline for the remediation grants?
Unfortunately, I don't. Have you heard any timeline, Jeannie, from your conversations with EPA?
I think there were some things still in the works. So
yeah.
As far as I have heard, I'm not aware of the timelines quite yet.
Yeah.
But it's very exciting that this funding is available and that there is enough for every state to apply, whether they have a law in place or not. Right. So
yeah. It's very exciting. I'm pretty sure they said that they would be out. The call for state participation would be out sometime, within the first half of next year, but I am not positive about that for remediation grants.
And then Ty asks, so many of us work in schools or government agencies, so there's only so much advocacy that we can do. And in the absence of funding for testing or state mandates for testing, what are the best steps for schools to ensure that we are protecting our students?
So without a mandate for testing, many school districts have taken it upon themselves to do testing within their schools. I would say Boston Public Schools is probably the best example of that. Massachusetts doesn't have a law, and they have some regulations at the state level, but actually the school district itself has been the driver behind testing. So I think it's totally reasonable to ask for testing within a school if you're working on the school level to make sure that you're providing safe drinking water. In doing that, you could bring up the possibility of other sort of short-term fixes, like providing water to students, providing filters at drinking water outlets, things like that might make the results of testing seem less scary to the people that you're asking for testing from. So you could say, we really want testing. It's really important to us that we know what the risk is to our students. And if a risk is found, here are some things that we could do. We could provide filters. We could provide some bottled water for a while. Boston went through all of this when they were deciding to test. So there's some things you can do regardless. I would say, I know you're limited on what you can advocate for, but advocating for knowing whether our schools have lead in the drinking water is not the same as advocating for legislation. And so you're a source of information from your schools, and it's not like lobbying or advocacy to share that information with people who could make a difference. So I'd encourage you to speak up in some way, in whatever way you're comfortable speaking up.
Great point. And I think it's important to realize too that what we can do as private citizens as well, outside of our work life, Me being a parent, I can, approach the school in my role as a parent and not in my role as, what I do during my workday. So that's a really important thing to remember. Mm-hmm. And I think you mentioned a couple of different partners that we might think about. One is parents, which I just mentioned, because you mentioned the idea of some schools have to let them know why they're not testing. So have you seen examples of kind of parents becoming galvanized and playing a big role in sort of pressuring the schools or the other entities to test?
Yeah, I mean, the best examples of those I've seen in Pennsylvania, where that law is pretty clear that's the accountability measure for that law. I've also seen good examples. So New York is a pretty strong law. There's good accountability. There's really good communication to parents and principals and that sort of thing. Mm-hmm. And that where we have good information going to parents, then parents have the information they need to say something if they feel like there's a risk to their students. So what I am hearing as well from the people that we interviewed from state agencies in this paper was that having your Office of Public Health or whatever the equivalent is where you are, having them completely on board, ready with communication materials, whatever it is critically important, because they will be getting the calls mm-hmm. if a parent is concerned about something they're seeing in testing results. That office will often be the one to get calls from parents, and they need to be equipped to say, to relay information that is accurate and useful for the parents. Unfortunately, in states where testing's not happening and there's no requirement to communicate with parents about drinking water, I mean, it's really only when there's a crisis that we're seeing like the news stories about parents getting involved. So many times when they don't know, they just don't know and don't feel right. empowered to speak up.
Yeah.
So
parents can be a powerful force. Yeah.
Right. Yeah. The school district I mentioned quickly in Louisiana, mm-hmm. where they've had really bad water quality problems, their water started like running brown. So like we don't want that to be the point at which we have to get in order for something to trigger in the community.
Right. Mm-hmm. Well, I think it's also important to involve community partners. And you mentioned, for example, in California, them using, if I'm interpreting what you said correctly, that they involved basically the utilities. Like yes. Utilities department or whatever. Mm-hmm. And then you also mentioned consultants. Are there other community partners that, let's say a school wants to take on this issue, who could they reach out to within the community that would be helpful in terms of having the skills and knowledge to test as well as remediate?
Yeah, any environmental health type professional would either be capable of doing water quality testing or would know where to go for that. So those are the sort of environmental engineering firms. They often are the same people that do like asbestos testing on construction sites and that kind of thing. Like it's sort of the same field. So those are the people that would be your allies in testing. And if there seems to be an issue that you're noticing, or the school has sort of the profile, this like an old school in an old part of the country that is known for having lead service lines in the city or whatever, any of those sort of risk factors, one of those firms might actually donate testing just to sort of see what's happening there. It's possible, especially if they have a connection to the school or care about the community that you're working in.
Right.
So that could be a good partner. There are programs across the country where community water systems provide testing to homeowners for free to understand, because they're required to understand how their water is getting to outlets around their system. Like I said, it's not required to be schools that they are testing, but you could work with the community water system and see if you could get the school system sort of designated as a site that they would test the water. It's not something I've seen school systems do, but especially if you're in a small area, a more rural area or something like that, it might be possible for you to work with that utility on that.
Great suggestion, yeah. And Paul mentioned we had success in Indiana in partnering with the Geological Survey Group through one of our state universities. They did quite a bit of the on-site testing for us. That's a great solution. And I was actually, that was sort of bouncing around in my mind as well. So way to go, Paul. We had a little mind meld, because I was thinking there may be a university nearby that has environmental health and safety or something along those lines that they might be willing to have students come out and learn how to do the testing, and that might be a great way to kind of partner.
Absolutely, yeah. I mean, if any of you saw the reporting around the Flint water crisis, that's what happened there. It was a university professor and his crew who were contacted by some of the residents there and asked to do that work, and that's how they started finding out what was happening to the water in the water system. So it's sort of that in combination with increased lead blood levels in the area that started, tipping everyone off to the fact that there was a problem. So that's a great point for a partnership.
Yeah, terrific. Any other questions while we have Anisa here and her wealth of knowledge? I'll give you a moment to maybe type in the chat box. Caitlin, could I ask you to put up our closing slides? And we are doing that now. And I'll give everyone an opportunity to type any final questions or comments that you might have. And let me just remind you that there is continuing education available for this webinar. It is eligible for one entry-level CHES, CNE, and though not today, typically we will have, if the topic is apropos, for IC and RC certified prevention specialist. If you don't know what that is, you probably don't have that certification. We also offer participation certificates as well if you have a different organization that you want to submit this CE for. Just as a reminder, members receive free continuing education credits. Non-members may purchase at $30 per hour, so membership has its benefits. And you can get your continuing education by completing the webinar evaluation, and we will put that link in the chat box. Oh, there it is right there. So all you have to do is click on that, fill it out, and we'll get your certificate to you. Let's see. I want to remind everyone as well about our conference in, I almost said St. Louis. That is not at all where it is. In Cincinnati, October 2nd through 4th, 2019. So make sure you mark your calendar. And feel free to reach out to us at any time, whether that be through our website, give us a call, or connect with us on social media. And one more opportunity to ask any follow-up questions or make any comments. Okay, well, I want to thank everyone for your time today. I want to thank you for engaging with us today. And Anisa, thank you so much for all of your great information and your expertise. We really appreciate it, and we've benefited a lot. So everyone, have a great day. Thank you so much for joining us.
Thank you. Thanks for having me.
Thank you.